Welcome everyone to Health and Wellness Thursdays. I'm Rebecca Crane-Okada, and I'm accompanied by Alston Novak, who is assisting our program with all things wonderful. And we're pleased today to have the guest, Dr. Elizabeth Fine, who I'm going to introduce in a moment. Just to review the structure of this time, we'll do a quick presentation by Dr. Fine, and there will be time at the end for questions and answers. This is recorded and will be available on our YouTube site. So, and I am sure she will field questions if need be afterwards, if there's something we can assist with. So like I said, I'm Rebecca Crane-Okada. I'm the clinical nurse specialist and program manager here for the Breast Center, and see patients for stress management, help the nurse navigators, and oversee all of these support programs. Alston Novak, would you like to introduce yourself, please?
Hi, I'm Alston Novak. I work with Cancer Support Services in the Margie Petersen Breast Center, and I assist Becky with helping run all the different programs that we have here at the Breast Center, including these health and wellness webinars. Happy to be here.
And I'm going to introduce Dr. Fine. I met Dr. Fine recently, and we had such a wonderful connection, and I'm so thrilled she's here with us today. Dr. Fine is the Dean of Clinical Education at Emperor's College here in Santa Monica. It is the #1 acupuncture college in California. She's licensed as an acupuncturist for 20 years. Her clinical interests include women's reproductive health and wellness, migraines, and head pain. That's an interesting one, head pain, gynecologic oncology, and more. She received her Bachelor of Arts in East Asian Languages and Culture from Columbia University, and a master's degree in social work from the University of Denver, and her master's and doctoral degrees from Emperor's College. From 2014 to 2017, she was part of the integrative team at the Saul and Joyce Brandman Breast Cancer Center at Cedars-Sinai, where she treated and lectured to patients for Women's Journey to Wellness, which is a breast cancer survivorship program they have there. She maintained a private practice of acupuncture in Los Angeles for 20 years prior to her role as the Dean of Clinical Education at Emperor's College. So we're thrilled to have you here, Elizabeth, and I turn the floor over to you. I'm going to stop sharing my screen and allow you to take over.
Great. Hi, everyone, and thank you for that very kind introduction. I'm Elizabeth, Dr. Fine. You can call me Elizabeth. It's so fine, which is my name, my last name. And I'm really happy to be here with you today to share with you some information. So I will definitely leave room at the end, but if something is a burning question that you'd like at that moment, something you don't understand about what I'm saying, feel free to use your little, icon things and jump in or whatever. You're welcome to interrupt. All right, so this says traditional East Asian medicine team. Sometimes it's referred to as acupuncture. Sometimes it's referred to as Chinese medicine. Sometimes it's referred to as Oriental medicine. That is often what you will hear it called. Within the profession recently, that it's kind of been done away with. So I try to say East Asian medicine, and that includes Japanese, Korean styles, Chinese styles, many different parts of acupuncture. So we're going to talk about that and of what the rest of the umbrella of this medicine is. And we're going to talk about that today in terms of breast cancer survivorship. Okay, so first of all, yes, I wanted to show you my little logo here from Emperor's College. And as Becky said, I'm the dean of the college. And I also want to put this little bug in your ear that the college right now is down the street from St. John's. And we have a clinic that is open to the public. And it is a low-cost clinic, and we have supervisors here who supervise. They're already doctors of the medicine, and we supervise the students. It's kind of like a residency program. And so I want to offer you all who are here today to come to the clinic and have a free treatment. And I will gladly comp you a treatment if you want to have acupuncture at the clinic. And so you can get in touch with me later about that if you'd like, and I'll give you the information. Okay. So let's talk about acupuncture and this medicine. So I tend to call it acupuncture or Chinese medicine, but it really encompasses all of these different parts of the medicine. So you can see some beautiful pictures here. It includes acupuncture, of course, where you see the needles, and we'll talk about that more, but it also has to do with specific aspects of sometimes Tai Chi exercises or what's called Qigong exercises. And sometimes they may even be offering that at different parts of St. John's, or you might see that at programs at the YMCA and other places. It also encompasses Chinese nutrition. This is a little bit of a different aspect of nutrition than just regular Western notions of nutrition. There's also cupping, and you may have seen that get really big during the Olympics, right? And Michael Phelps in particular was like, oh, and even The Rock, right, has like these big purple cupping marks. People are like, oh, is that dangerous? So it's actually really normal to have cupping marks like that on your back after you get cupping. Now, people who've gone through breast cancer treatment who are in the middle of it anyway, there are certain things that you would need to know about maybe not getting cupping during the time when you're doing chemo, for instance. So it's important to know always who you're working with. And it's not a problem otherwise. Okay, in the middle here, you see some herbal tea. And so that's another part of the medicine. Traditionally in China, people were either herbalists or acupuncturists. Now we both tend to do both. And that can be raw herbs, like in this little glass, there are actually, you can see floating herbs. We often tend to give herbs as a powder granule form now. People don't really want to boil and take their own herbs. They taste really bad, but they are stronger. They are sometimes, if you've seen these little Korean packages, they're like these little squishy packs of the herbs that you snip open and drink down. And those would all be done by a licensed acupuncturist. So I wanted you to just know for a moment about the training in California, okay? Because this is a very serious degree to get. So I think that it's important for you all to know as breast cancer survivors or in treatment that when you're licensed in the state of California, you have to go through very aggressive training. We're doing a 4-year training program. And we also have very serious acupuncture boards. Okay, that anything that is a board in the state of California is going to be pretty serious. We also have accreditation commission. We also have to do 1,000 hours of clinical residency. In addition to didactic, we also do classes in anatomy, physiology, Western medicine, Western physical assessment. We do blood pressure, all of these things that regular doctors have to do as well. So I just want you to know that there's very high standards of training if you've been licensed in the state of California. And at our school, we also have things called externships, okay, which means that the students do training at different schools and they do different trainings at different locations to get their training, just like a resident, basically. And so one of them is at St. Joseph's, Providence St. Joseph's out in Burbank, right? And we do work there at the cancer center there. We also have one that's been going on for about 25 years at Venice Family Clinic. And most recently, we started working at the VA. So we're really proud of this because we're the first VA in the country where we're giving acupuncture for veterans with trauma and pain. Okay, so let's get into the medicine a little bit here. So the philosophy of East Asian medicine is that balance is dynamic and always changing. So the reason I have a picture here of a scale, right? Maybe versus a yin-yang symbol. This yin-yang symbol is called a Wuji or a Taiji symbol. And everybody has seen it. Now it seems like it's on every other beverage at Whole Foods and at Trader Joe's, right? Everybody knows this symbol now. But I wanted to superimpose it here with the scale because I think especially for something like survivorship or when people are going through treatment, there's this idea that patients will come afterwards or during and they say, well, I want to be balanced. And you feel like if you're not balanced, that you're not in the game to be able to have good health, right? And what happens if you get to that point of balance? Do you finally get there and the balance is exactly even? So then what happens when you lose the balance? Does that mean that you can't have real health? if you're somewhere other than on that completely balanced path. It's kind of like it's kind of a setup, I think, where you can feel really badly about maybe that you're not doing as well as you'd like to be doing because you're not as balanced, you're not feeling as well, you're dealing with emotional issues, you're dealing with pain issues. So how do we approach this from a Chinese medical perspective is that the yin yang symbol is something that is always changing. It's always moving. We only have lightness because of the dark, right? Wellness is kind of relative, even in a way, and you can be anywhere on that symbol at any given time, right? And now, for instance, in fact, today is the fall equinox, right? So there is actually a moment today on the 21st, I think it's this evening, where there's going to be this, like there actually probably is this one tiny like millisecond of complete balance, right? But then it's going to start moving, right? And actually at the time of the equinox, we start losing the light, right? It's going to start moving more towards the darkness. And so we're starting to have that flip, and we might even be feeling like weirdly emotional this time of year. We feel like a little bit off when the seasons change. Sometimes grief comes up for people in the fall. The leaves are falling off of the trees, right? So this is the yin yang symbol is about change and cycles, right? So this is how we think of this in Chinese medicine. Okay, so in order to understand the acupuncture, we have to understand this idea of qi. And qi is thrown around a lot now. Again, I think it's like they're talking about it on the morning show on Drew Barrymore or something, right? So qi in Chinese language is really, it's kind of translated as a vital energy, although even that is kind of inaccurate. I think like the best thing to do is to not translate it and to just say qi, right? But really what it is, the reason I have this bowl of rice in the middle is because this is the character for qi. And this is actually underneath this part of the character. This is a piece of cooked rice, okay? And when you see the rice in the middle, it has steam coming off of it, evaporating, right? Transforming, right? From something cooked, almost like ATP, if you were ever a student of biology and you had to study that. I think I did really badly in that class, but that's what it's about. It's about this transformation of energy, okay? And so even so, if it were food, we're bringing it into our body, right? And we're using that food to transform so that we can live our lives and have the energy that we need. Okay, so above here, we have this, the character for steam or clouds. So again, this character is very much about having something that's a kernel of energy and then something that is transforming, right? Almost like physics, okay? So this qi is said to be what flows on the meridians and the pathways. Okay, so here's somebody getting acupuncture, and some of the important things about this, I'm going to show you a little video, is that it's non-pharmacological. Sometimes patients will ask, is there anything on the needles? Right? Is there something that we put on the end of the needles? No, the needles are stainless steel and they are sterile. One-time use. They go in that red sharps container. Right. We also have to pass strict guidelines for OSHA and clean needle technique, which makes sure that we're being very careful. And that's very important, of course, for patients who are going through chemo and cancer and have immune system issues, right? So generally, the needles are placed in the body for about 25 minutes, sometimes laying face up, sometimes laying face down. And if you're going to get acupuncture, one of the things to know is that a treatment prescription is going to be more than just coming one time, right? And that's what's good about either having some insurance or coming to a lower income clinic, because if you're going to have to pay $150 for acupuncture and nobody's going to cover it and they want you to come twice a week, right? Unless you're somebody who's really lucky, it can add up quickly. Okay, so these are small needles and they're really as fine as a piece of hair. And they are inserted into the body, but not very far, right? Very superficial. And they're activating acupuncture points. So instead of trying to explain that to you more, I'm going to show you a little video. So people always want to know, does it hurt? If you see, this is the size of it, right? A sewing needle is here, matchstick. This is how thin it is. The gauge is 0.25 millimeters. It's extremely thin. And they're actually very smooth, and most people think that it feels good once they're in. There are people who don't like it. There are people who will never have acupuncture because they don't like the needles, and it's not for everybody, right? Okay, and most of the needles are going to be put into the arms and the legs. Okay, just because you've had breast issues doesn't mean they're going to put needles into the breast. Okay, because it's like a freeway of energy. So I'm hoping that this will work. And I'm going to show you. Well, can you hear this or no? Can you hear it or no? No? Okay, I'm going to stop the share for a minute and I'm going to share the screen. Usually if I do this, it'll help. This is very short. Now?
Acupuncture involves stimulating body walls like skin and muscle to produce therapeutic effect. It can be used for a very wide range of conditions: acute pain, chronic pain, and respiratory conditions, skin problems, and gastric problems. So if you can imagine your body is a city. So in a city, there are big roads, highways, there are small roads, there are laneways. So if everything's fine, then traffic goes nicely. So when there's a car breaks down, and the traffic will jam up. And if the broken car is not being fixed, the traffic jam will become worse and worse. Let's imagine in the body there are meridians. And in these meridians, we have qi flow, we have energy flow. Say, for instance, if you hurt your back, and the local muscle will become very tight. And this kind of tightness is a way of blocking the qi flow. So to restore that, to reduce that problem, we have to put needle into the local area to help the broken car in a way. But also we will put needles away from low back to divert traffic, to restore the qi flow.
So that's basically what it is like. It's like body is a freeway of energy. And when she gets stuck, there's a traffic jam. And the acupuncture needles help to relieve the traffic jam. And that happens on a cellular level, really. If you think about it, your body's 98% water, and water is a good conductor of energy, right? And then you put in something that is metal, which also conducts energy, and it actually has a physiological response across the cells, as well as being from your hypothalamus and your pituitary in the brain, right? Through like the neuroendocrine system, essentially. Right. And I heard someone asking questions earlier about sleep, and that's why it can help with sleep, is that it's really a nervous system medicine. So these are some of the different points. And yes, we have to learn all of them, and that's stressful. Okay. This is also why if you have a problem in your head, you could use a point on your hand, because it's a freeway, right? And so if there's a problem with the 405, you could have a traffic jam at the 405 and the 101, but that could cause problems all the way down to San Diego if there was a big traffic jam, right? I also wanted to show this to you because this shows how these meridians also run through the breast. Okay, so there is a connection with certain channels, or what we call these meridians, and qi flow and stuck qi happening in the breast, which ultimately is how we describe breast cancer and from the Eastern perspective. Okay, and that's also why you wouldn't have to use, a needle right on the breast to do this, right? Okay, so I look at it like a computer, right? So your mind is the computer, and you're using a keyboard to type in messages. So the needle is like a message typing into the brain and telling the brain to spit out some different neurological, immunological, opioid peptides, and it induces analgesia, right? So you type in the message by putting in an acupuncture point, travels up to the brain, tells your brain, make changes, spit it back out, right? So this is how it works. It also is shown in research to increase circulation and to reduce inflammation. Okay. But another important, yes, yes, sure.
Previous slide, bullet number 3. That one.
This one?
Yes, the words endogenous opiate peptides to induce analgesia.
Yes.
For us lay people.
It stops pain. It stops pain. It adjusts how the nervous system interprets pain. So it'll help stop a pain response. It'll block pain receptors. It blocks pain receptors. Yeah. Good question. Thank you for asking that. All right, so there's this other part of the medicine that's called spirit or Shen, right? And the Shen is like the light that comes off of a candle, right? And it's really about your consciousness, your spirituality, your soul being, right? And this is a big part of the medicine as well. Okay, we often say in the medicine that your life is like a candle. Okay, and we talk about these other ideas. We're not going to go into this today. This is called Jing, but we have Qi that we talked about, and then we have Shen. Jing is like the candle itself. If you think of Jing, it's like your DNA. It's kind of like what you're born with, right? So if your Qi is not strong or your Qi is stuck, and your Qi is like the wick and the flame, so the Shen, the spirit, is only going to be able to shine as brightly as the quality of Qi, essentially, which is why when the traffic jam is stuck and we're stressed out, or we actually have an accident and the Qi is stuck, right? We're in pain. It's hard for our spirit to really be able to shine, right? Okay, so acupuncture can also directly work on that. I mean, essentially, it's just saying that it helps calm down. It helps you to be able to feel grounded and to kind of see your truest self and connect with who you really are. It's a relaxing and it helps deal with stress. Okay. So in survivorship, I know that these are some issues that people are dealing with, especially there's been research showing that acupuncture can help with problems with aromatase inhibitors and joint pain. That's some of the strongest research in acupuncture with evidence for it working for breast cancer survivorship, especially neuralgia, also neuropathy, right? If anyone has had the kind of chemo that gives you neuropathy and numbness and tingling in your feet, I've had some good success working with that with patients. And it's not an either or situation. Some patients don't respond to the drug. You know, they might give them gabapentin, they don't respond to it, or other patients respond when you do both. Right. So it can be very good for that if you're struggling with that. Also good for fatigue, right? Chemo brain, right? Insomnia, absolutely. I will tell you with insomnia, it's usually the acupuncture is very good for that. It usually takes time, right? And you can use herbs for that as well. You need to go to somebody who is experienced, because especially with post breast cancer, you want to make sure that you're not taking any herbs that might have any kind of estrogenic quality, right? So you need to your acupuncturist needs to be thinking about that. But acupuncture itself can be really helpful for insomnia. But again, it's something that you need to do consistently, maybe once or twice a week for maybe 8 sessions, and then with reevaluation. Obviously, you don't want somebody who's just treating you with no end, just keep coming. You know, at what point as a lay person do you go, is this working? Is this not working? Do I need more time? You know, when you're going to see an acupuncturist, if you don't know anything about it, I always think it's kind of like going to a mechanic or a dentist where you don't know anything about it. So I'm like, I go to get my car fixed and they tell me all these things that I need. And I'm like, oh, I guess that's what I need, But if you don't know, are they taking you for a ride? Or is it for real, right? So I can tell you that with something like insomnia, right? I think it is a multifaceted thing. It has to do with sleep hygiene. It has to do with exercise. Acupuncture certainly adds to the mix. You can do herbs. You can do meditation. Tai Chi is excellent. Okay, so these things together can help. And of course, for survivorship, it can also have to do with lack of estrogen, especially if you're on tamoxifen or aromatase inhibitors, which, as we know, when patients are in menopause, postmenopausal, whether that's induced by drugs or otherwise, that sleep gets worse, right? Certainly we can use it for neck issues, for ROM is range of motion issues, okay, post-surgical pain and hot flashes. It works very well for hot flashes. The research is sort of mixed on this, but clinically, I find it effective, absolutely. Okay. Osteopenia also, meaning that, you know, you want to be keeping your bones strong. So some of the ways it can help with is pain management, as I said, musculoskeletal complaints. I even know patients who had cold caps, right, during treatment, and they're really heavy and it would bother patients' necks. So sometimes they would do acupuncture for that. Also for, you know, shoulder issues after a mastectomy, right? Hot flashes, stress and anxiety, right? And just all of the dealing with stress and the emotional aspects of it, and being able to go to an acupuncture office where you can kind of bring yourself there and have a different experience of being than in the Western medical facility. It's really nice to have a place to go to. Okay. All AI-induced arthralgias, meaning aromatase inhibitor pain. Okay, lymphedema for patients who struggle with that. I will say that there's also mixed research about whether or not you should get acupuncture needles in an arm that you have had lymphedema in. If you're experiencing lymphedema, there's a way to be able to use acupuncture without doing it on the affected limb. Right? But again, the research is mixed as to whether or not it even, like some say it helps to do it on the limb. So it really depends. And as we have talked about the chemo-induced brain fog, I wanted to show you over here, this is the ear. This is auricular acupuncture, where you literally put needles in the ear. It's quite effective. Okay, and in fact, I'm going to show you this point. So this gives us something fun to do. This is a point that's called Shen Men, right? Now I taught you the word for Shen already, which means spirit, and Men means gate. So this point is actually called spirit gate, or sometimes it's called neuro gate. And if you look on the ear in this little triangular area, that's exactly where the point is, okay? But you can also just massage your ears, right? And so you can have somebody who loves you do it for you, or you can do it for yourself. And one easy way to do it is we do this thing called the monkey, where you bring one arm over here over the top of your head, and then you bring the other one to the other side. And I'm gonna have to take my off for this, hold on. Okay, so everybody's gonna try it with me. Take your hand and you take the top of your earlobe, right? And then you take your other hand and you do the bottom earlobe. So you kind of look like a monkey while you're doing this. And you can massage your ears like this. You can also, of course, just massage them like this. And so if you want, if you can figure out where that little point is, it's not hard to find. You can even take your fingernail and you can just put acupressure on that point. Okay. Now, when we do it with acupuncture, we actually do pressure. We do needles on that point, but you can also massage. So there are many, many points on the ear, and it's very relaxing to work on the ear. And you can also just do overall massage on the ear. This is why I think dogs also like love massage. So it's a very good point for anxiety, depression, stress. You can do it when you're driving and somebody's like throwing road rage at you. Okay. Okay, this is another point. And we're going to be done in a minute here, and then I can answer questions or show you more things if you like. Okay. This is called pericardium 6. It's called PC6. It's called the inner gate. You see, so very similar word to the door. This is a gate, and this is called ne, meaning inner. It's inner gate because it's the inner part of your wrist. It's also the inner gate of your heart. Okay, so it's kind of like related to that idea of Shen. So this point is the point that you might have heard about when people are using it for seasickness, right? And they get those seasick bands, right? So in order to find this point, you take your 3 fingers, right? Take your 3 fingers, put them up to the top of your wrist. So you point your fingers at your wrist bend, right? And then you just go 3 fingers down. And like that. You can show me on the screen if you want, and I can show you if you're doing it right. Yeah, just like that. Alston's got it. Right? Okay, so like your wrist can bend like that, right? So you put it there like that. And then where your third finger falls, in between those tendons, right where the third finger falls, in between those tendons, that's where the point is. That's where the point is. Yep. Shaban's got that right. That's where the point is. And you could literally put a bean there and put a piece of tape on it if you wanted to. You can also just massage it. And if you were getting acupuncture, you'd actually get a needle in that area. Okay. Now, that point is the point that is used, the WHO, right, the World Health Organization, they use this point for nausea and vomiting. It's good for pregnancy, nausea and vomiting. It's also good for post-operative chemotherapy-induced nausea. It's also good for anxiety. It's good for digestion. Okay. It's just a good point to press on if you're really nauseous, if you're out at a restaurant or something and you're really nauseous, you know, with ginger candy, it can really help. Ginger, of course, is another great thing to use for nausea. So yeah, three fingers and then right in the middle there, and you can take your fingernail and kind of press on it like that. Now, it can help. Now, am I saying like it'll wipe out? I mean, if a patient is having, you know, a hyperemesis, like severe nausea and vomiting, it won't always help with that level, right? It's a very good point if you are coming home from the hospital, you're feeling nauseous, you're feeling heart palpitations. It's a really important point to know, and especially the pericardium channel is actually the protector of your heart, right? That's what your pericardium is. It's like the wrapper around your heart. So metaphorically, this is a point that protects the heart. So when you're feeling anxious and emotional, it's a very, very important point. Okay. So if you have any questions, I mean, obviously I can keep talking about this for a long time. Please feel free to contact me. My email is here. And again, I really, truly welcome you to come to Emperor's College. Even if you don't get in touch with me, if you call the front desk and tell them I was on a call with Dr. Fine and she said she'd comp me a treatment, I would be happy to do that for all of you. And in fact, the clinic is moving to a beautiful new setting in January in Corporate Point, which is in Culver City, not far down the road from Sprouts, near Antioch University. So I hope to see some more of you soon. And if you're interested in learning more about acupuncture, please feel free to get in touch with me. And I know that I don't live in an either or world where there's a us versus them, where acupuncture is better and Western medicine is not, or any of that kind of nonsense. This is an integrative medicine where we can use it to support the good care that you're already getting from St. John's. So thank you so much for having me today.
Thank you, Dr. Fine. How about any questions from the group? Go right ahead, Susie.
Yeah. My question is, it sounds like the needles hit a certain point to do what they do, but if you're talking about physical therapy on the flip side, where they're sometimes using the thumbs or the elbows to also hit certain points, what would you say is the distinction?
Yeah. Well, first of all, it's you're bringing up something about physical therapists. I just want to encourage all of you who do physical therapy to not have dry needling done by a physical therapist. There's a whole movement of physical therapists who feel like they are, and I'm not trying to, I love physical therapists, but I don't think they should be doing acupuncture and putting needles in people at all. Aside from that, I think the difference is that there's a different conduction of energy that goes on, because acupuncture, you're really putting a needle into the body and it sends out a cascade, right? It's more of a nervous system response. It works more with neurotransmitters. It's really triggering the brain to have a response that kind of cascades down into the body. I think that physical therapy, of course, is amazing and it has its place, but I think that they're dealing more with muscular issues and trigger point therapy, for instance. And I think that they work really well together. I think one of the things that happens is that when you're already getting a course of physical therapy, I've had patients who are trying to come and do both, and it can be really overwhelming to try to figure out to do both and which should I do. So what I would say in that situation is you finish your physical therapy, you do, like, I don't encourage patients to have physical therapy and acupuncture on the same day. I think it's too much. Also, I think acupuncture is good for pain response. So let's say you have something that is more of like a nerve pain thing that's happening with sciatica. You know, it's not necessarily muscular, but it's coming from your low back because of the nerves. I think that acupuncture can have a better or different response to that than just doing manipulation. But I think that, I mean, I go to see a chiropractor or I'll go for physical therapy. I think it's different. I think part of physical therapy is about helping your body to become stronger so that you're using certain muscles so that you're not overcompensating with other muscles. And especially after mastectomy and surgery and things, you need to strengthen those muscles. So I think that they work well together, but they're different.
And can I ask a second question?
Mhm.
Okay. With insomnia, I think what I heard you say was that you could come in and have like once a week acupuncture, and that would eventually help. So if you come in and say that's my problem, you'll do whatever you do, and then you think that will help that week, or it'll help you that night, and then you wait until next week for another treatment?
Sure. That's a really good question. So acupuncture is cumulative, right? And I mean, listen, if somebody has had insomnia for 10 years, we say, you know, it takes a month for every year that you've had something. So you didn't get, not you personally, but in general, people don't get these problems overnight. And so they don't often, it's not what I would call a fast food medicine. I'm not saying you're saying that. I'm just saying like it takes time to unravel problems. It's cumulative. So, and often the effect of the treatment will last for maybe 24 to 48 hours. So one thing that would happen is that you go home and the first night you sleep a little better and you're like, oh, great. But then the third night it starts to come back, right? And so it's cumulative. It takes time for it to even out, where you've done maybe a course of treatments for 3 months, but then you're also able to add other things in, such as, you know, mindfulness or certain herbal remedies that are okay to do, or, you know, Tai Chi or whatever else it is, or sleep hygiene. So I think it's with insomnia, it's several things together that help. But what I would expect to happen is that it might be possible that you go to a couple treatments and you start to notice a difference, but after a couple days, it starts to wear off, which is why in China, they might treat you literally, a course of treatment might be every day or every other day for, you know, 3 weeks. In the United States, patients don't have the time or finances, because things aren't set up the same as they are in China, to be able to have acupuncture every day, right? And then people say, well, it didn't work. So that's the situation. But I would say something with stubborn insomnia, if you have the capacity and the ability and the time to come twice a week, I think you have to say, all right, I'm going to dedicate to trying to do acupuncture twice a week for 8 weeks and see if it helps, which is why also you can come to the clinic, and the treatments are low cost. So you could try it. And then also consider taking herbs as well, assuming that they're not anything, that you can't be taking. And by the way, asking your doctor about it, the problem with asking your doctor about herbs is sometimes they really just don't know, is so much about the Chinese herbs. It's not that they don't want to say, okay, but they don't know, are they safe or not?
Dr. Fine, I was thinking about what you said as the chronicity of the problem. And sometimes I think it's like in some things we have to unlearn the bad behavior or the habit. Could you say this is the same thing with the body, that these habits of poor sleep kind of build up over time? And that's what you're doing with acupuncture, or is it still very different?
I think it's like, that's a good question. I think it's like a necklace where there's lots of knots in the necklace and you're trying to unravel it and like get the knots out. But sometimes when we pull really tight on it, it actually makes those knots worse. And so you have to try to like loosen up different parts of it in order to try to unravel it. But I will also say that I think there are people who have had, I'll talk to my best friend who has sleep problems, who's actually also she was BRCA and has had a prevention mastectomy and her ovaries out. And she always had sleep problems to begin with, right? And then ever since I've known her, since we were teens, and now she still has sleep problems, right? And they've gotten maybe worse for her over time, because I think that the situation there is when you have no more estrogen. So I think it's really important to also not put it on, and I'm not saying you are, but I'm saying I think it's important to not always put it on that it's stuff that we're doing and it's our poor habits, because that turns into it being our fault, which is like the last way we want to feel when we're not, doing well. And I think some of it is literally like brain chemistry, and so I think acupuncture, Tai Chi, and learning, instead of what do we have to unlearn, it's like, what can we add in? Right. It's like with diet and stuff, instead of I can't eat that. Right. I think we're finally in a movement with diet now, which isn't about there's no bad food. Right. Isn't that the newest phrase we hear? No bad food is like there's nothing that we can't eat, but what can we add in that's going to be more helpful. Right. And I still believe also that, the combination of phones and social media, even for older people, it's not great. And so I think sleep hygiene is really important. Are we really like toning it down at night? Are we walking our 150 minutes a week if we can? What are we doing at nighttime before we go to bed? And I do think it's related to stress and trauma and all of those things. But I do think that with breast cancer, post breast cancer, not having estrogen just really makes everything so much worse.
I think the necklace analogy is very good. Can you speak to how long an acupuncture treatment will take if someone were to go in? What's the routine?
Sure. So with any acupuncture clinic or practitioner that you're going to go and see, you're going to come in and they're going to do a very involved intake where they're going to ask lots of questions, some which may seem unrelated, right? Because you're like, well, I'm not, why are you asking me about my, digestion or something? But that's all very important information to us. So I'm going to fill out paperwork, do an intake, and then we do something called tongue diagnosis, right? Where we actually look at the tongue. The tongue gives us a lot of information about what's going on inside the body, right? As well as we feel the pulse. And we're not feeling the pulse necessarily. We are feeling the pulse for the beats, but we're also feeling it from a Chinese medical perspective, that it gives us information about the meridians and how they're flowing in the body. And then if it's at the clinic, the student does all of that, and then they go and speak with the doctor. And like I said, like many of our doctors are trained in China, from China, and have been practicing for 25 years, and they're amazing. So this is like amazing to have the experience of going to doctors who had their direct training from China. So then they'll talk to the patient, or if you're already licensed and you're going to another practitioner, they're going to listen to your story. They're going to take all this information together, look at your chief complaint, of course, whether that's, neuropathy in your feet, or fatigue, or I'm just having anxiety, or I have pain in my fingers and my joints, whatever it is. And then they're going to give you acupuncture. When you're actually on the table for acupuncture, it's usually about 25 minutes. And I would say the needles are anywhere from 8 to 20. Maybe. They're usually bilateral, meaning that if you're going to have one on the right, like LI4, many people know this point right here, right between the fingers. This is called large intestine 4. This point is very good for head pain, any kind of pain, really, for headaches. So they might put that needle in. If they're going to do it, they might do it on both sides. So you're laying on the table, face up on a massage table. It's very relaxing. Put the needles in. Usually there's a nice heat lamp to keep you warm. Then they dim the lights, right? Leave the room. They give you a little buzzer so that you can click on it if something happens and you're uncomfortable, so you're not left having needles in and feeling like you can't move. And then they come and check on you. And then after 25 minutes, they take the needles out and put them in the sharps container, and then you're done for the day. So I would say the first time you come, it's usually, the treatments are about 1 hour and 15 minutes, but the acupuncture itself is a half hour.
Thank you. Any other questions? I know we're running over, but this is really good information. Any other questions from our participants?
I always have another question.
Go for it.
The anxiety and depression, which is relatively new, how does acupuncture help that?
Sure. So in the same way, I think that I talked about with the mechanisms, with acupuncture mechanisms, and there is research out there about how it works. I think that it works by working with neurotransmitters, right? Meaning serotonin, dopamine. So if you put in an acupuncture needle and it's like a message typing it into your brain, it can help to release more more neurotransmitters or help neurotransmitters stay more in your system. Okay. We also know that 70% of your serotonin is actually made in your gut. Okay, which is interesting for patients who have things like IBS and who are also have gone through chemo and have had, gut problems, digestive problems. So actually, by working on digestive issues with acupuncture, it can increase, it can help with depression and anxiety. Now, with that, also, there are points that they do on the head, right? It's not scary to have head points. Your skull is right here. There's nothing that can happen, right? So there's been research on that in China quite a bit, where they'll do points on the head or points even on the fingers. So again, we do it from in the feet, in the hands, in the arms. I think it's about working with brain chemistry and with the nervous system. It's really effective. It helps a lot, the stress and anxiety. It also works with blood pressure and with the heart. So if you're having heart palpitations, for instance, that kind of anxiety, it can help with that as well. Come and try it. We'll take good care of you. Come find me if you come.
Is it okay if I share my own experiences as someone who's had lots of acupuncture?
Oh, I love that.
Just over the years, I have gone for different reasons, but it all kind of comes down to like nervous system, like especially anxiety and depression, like through nursing school and, just all sorts of stuff. And the calming effect that acupuncture has had on me has been pretty tremendous.
Thank you for that
testimonial.
Thank you. Sometimes I wonder, like, I'll even ask myself this after 20 years. When I'm laying on the table, I'm like, if I just laid on the table and I didn't get acupuncture, would I feel as relaxed as if I got up and felt acupuncture, And we need more studies. I mean, we need, it's hard to make a good acupuncture evidence-based study, right? Because somebody knows if they're getting a needle or not, right? So how do you make a good study? But studies do show that, getting acupuncture versus points that aren't acupuncture points, it doesn't work as well. So I do think that the points are the points, and it does make a difference versus, a study where you're getting acupuncture, but they're not real points. But when I lecture, sometimes there's always somebody who will say even a placebo is 25%. So I'm like, okay, well, we'll take it if that's the case, but I do hope that all of my training is more than a placebo. And I hope that what you'll receive is more than a placebo. So thank you so much for your time. I wish you all very well. And
Thank you all.
Please reach
Thank
out at
you.
any time.